Hi guys, we're going to talk about building therapeutic relationships and effective communication. So when we talk about therapeutic relationship, we are talking about creating a space where caring and healing can occur. Encounters can occur in any nursing setting, and a nurse needs to be sensitive to the needs of the client by developing a rapport by using effective communication. So let's get started here. Beyond the hospital, the nurses have roles and responsibilities in advocating for mental wellness at the individual and community levels. Community challenges include a lack of awareness about mental health issues, stigma, unvoiced client expectations, and a scarcity of community outreach programs. To address these needs, nurses participate in a variety of leadership roles in healthcare organizations. Some of these roles include educator, where the nurse educates their clients on diagnosis, defense mechanisms, medications, risk factors, and much more. They can be a facilitator. The nurse can lead group discussions on risk factors and coping skills, or work to integrate the client's family or primary support system into the treatment plan to improve outcomes. The variety of care activities is best served by a nurse who is able to successfully manage care from the treatment team, both inpatient and outpatient. So to review Peplau, she's the theorist that followed Sullivan and expanded on his theories to establish and introduce the nurse-patient relationship. That name hopefully is review for you as you listen to the Therapist and Theories chapter. This relationship consisted of a nurse having skills and expertise to alleviate suffering, find solutions, and explore different avenues to increase quality of life for our patients. Peplau described that the nurse-patient relationship evolves through phases. So we can think about the orientation phase, identification, exploitation, and resolution. So the orientation phase establishes that relationship. It really sets the tone for that nurse-patient relationship. And we are going to identify those barriers, those boundaries during the orientation phase. And we'll talk about boundaries that we have to be mindful of to not cross. During the identification phase, the client presents a need that is not being met. So the ideal goal in the identification phase is to meet those needs, to help the client identify barriers to wellness. Barriers can include access to resources like finances, transportation, cultural or racial differences, and social support. So it's really important to consider that the client may or may not have clear insight on how those barriers are just really affecting their health. The exploitation phase is when the client is more accepting of the nurse's interventions and sees the nurse as a source of aid. Once trust has been established, the nurse should affirm the client's knowledge, skills, and attitude towards treatment. The client will need to feel independent in their care and have a sense of self-direction. A sense of autonomy is critical in the mental health population where medication adherence issues complicate those chronic treatments. And then the last phase is a resolution phase, sometimes also known as the termination phase. And this is when the client continues to build confidence in achieving those goals and experiences an improvement in self-reliance. A plan for continuing care is mutually developed between the patient and the nurse. The nurse's goal in the resolution phase is to ensure continuity of care and integrity of the professional relationship. So how do we build the nurse-patient foundation? The foundation must be solid in order to develop this relationship. This list here on the slide helps build that relationship. Appropriate use of small talk and humor can also help build rapport. The nurse can choose to use contractions or informal vocabulary. These techniques would ideally be used in the identification phase of the nurse-client relationship. However, the nurse does need to be careful to avoid barriers such as slang, innuendos, or other types of idioms. Patients don't have the choice to be there, so treating them with dignity and respect is vital. Nurses, again, should avoid jargon, but may use slang terms and more informal speech if appropriate. Ideally, the best way to communicate is determined in the orientation phase of that relationship. But we do have to think about some of the barriers that can perceive differences in gender, right? We don't talk to a female the same way we would talk to a male. What is their education level? What is their language or literacy? Racial, cultural ways of being, and socioeconomic status. So building healthy relationships can be based off of Maslow, again, another theorist that you should be familiar with. Remembering level 1 are those basic human needs. Food, water, shelter, sleep are very real needs for people, and we have to meet those needs first. The level 2 is the safety and security. This comes from consistency and predictability. This is where when you build those healthy relationships, you assess the need of the patient, you determine what is not met, and then you try to find strategies. So building the healthy relationship means that you're building from the bottom up. A relationship is an interpersonal process that involves 2 or more people. These relationships can be categorized as intimate, personal, or therapeutic. Intimate relationships occur when people have an emotional commitment to each other. Clearly, there are moral and ethical concerns about intimate relationships with our patients, and most certainly legal and professional restrictions. So we're going to focus on differences between personal and therapeutic relationships. So when we talk about personal relationships, we initiate for the purpose of a friendship, socialization, enjoyment, or accomplishment of a task. Mutual needs are met, and during these social interactions, communication skills may include giving advice and meeting basic dependency needs such as lending money or helping with jobs. Often, the content of communication is very superficial. In a therapeutic relationship, the nurse maximizes communication skills, understanding of human behaviors, and personal strengths to enhance the patient's growth. The needs of the patient are identified and explored, clear boundaries are established, problem-solving approaches are taken, new coping skills are developed, and behavioral changes are encouraged. This does not mean that the nurse is not friendly, but it does mean that talking about every day is discouraged. Small amount of self-disclosure on the nurse's part can strengthen that therapeutic relationship. So how do we maintain those professional boundaries? Boundaries can be considered the edge of professional behavior and exist to protect the patient. Boundary blurring interferes with treatment goals, so we must stay professional and therapeutic. Sigmund Freud first discussed the concept of transference and countertransference and the impact on relationships. Transference can be described as when a client experiences feelings or emotions from a person or object and displaces those feelings or emotions towards the nurse. This is an unconscious effort on behalf of the client that can result in feelings of affection or hostility towards the nurse. In some cases, transference is used to facilitate the meaningful work of therapy. If the nurse believes that their client may be experiencing negative type of transference, the nurse can reiterate their role as a professional in the relationship. If the client remains unwavered by the nurse's redirection attempt and the nurse is no longer able to work towards treatment goals, then they have to speak to their supervisor to work towards a better solution. When patient-centered care falls to too much care, then over-involvement can increase the risk of our boundaries and our roles. Over-involvement increases the risk of boundary crossing. So boundary crossing is when the relationship slips into a personal context, or when the nurse's needs, either attention, affection, or emotional support, are met at the expense of the patient. Boundary violations take advantage of the patient's vulnerability. It's usually characterized by a reversal of roles, where the needs of the nurse are being met rather than the patient's. And then professional sexual misconduct can also occur with over-involvement. And this is when the physical or verbal breach of contract that may include expressions of feelings and thoughts of gesture that are sexual or could reasonably be interpreted by the patient as sexual. So some factors that promote growth include genuineness, and that's the ability for the nurse to be open, honest, and authentic. This builds trust. Genuineness is conveyed by listening and communicating clearly with our patients. Empathy can be defined as temporarily trying to live in the other's life, moving about it in a delicately without making any judgment. When we distinguish between empathy and sympathy, this means we are able to understand the feelings of others, that's the empathetic part, versus feeling pity or sorrow for others, which is the sympathetic part. Sympathetic response may say, I feel so bad for you. I know how close you are with your mom. Where an empathetic response would be more of an attitude that conveys respect. This must be devastating for you. It must seem so unfair. When we talk about positive regard, this implies respect. This can be accomplished through your attitude and your actions. Our attitude might convey positive regard or respect and willingness to work with the patient. Actions that manifest an attitude of respect are attending, suspending value judgments, and helping patients develop those resources. When we talk about attending, this is a special kind of listening that refers to an intensity of presence or being with the patient. At times, simply being with another person during a painful time can definitely make a difference. So our ultimate goal when we are building that positive, healthy relationship is being respectful, being honest, and being trustworthy. So let's move into some communication strategies. Communication takes on a new emphasis with nursing care. Just as personal relationships are different from therapeutic relationships, basic communication is different from patient-centered, goal-directed, and scientifically based therapeutic communication. As nurses, we need to stress the importance of facial expressions that match our words and tone of voice. Different age groups and cultures need different approaches. Children and adolescents may require stronger facial expression to convey the message. So in general, with communication strategies, you can think of the mnemonic SOLAR. So sit squarely to the client, so right in front. Have an open posture, right? Keep your arms not crisscrossed in front of you, but open. Lean forward, make good eye contact, and relax. And that's going to give that patient that really strong thought that you are listening and you're communicating well. Nurses do need to be aware of how they communicate non-verbally. Nurses also should assess the client's nonverbal communication. Nonverbal communication may be sending the real message. So when we think about tone of voice, if we emphasize certain words and manner in which a person paces, speech are both considered nonverbal communication. Emphasis our physical appearance, right? If we're disheveled, that's going to speak a lot about us. Facial expressions is extremely important in the terms of nonverbal communication. The eyes and the mouth seem to hold the biggest clues on how someone is feeling. Body posture, You can see on our slide there, right? If you see these people and this is how their posture is, gives you kind of a clue as to how they're feeling. The amount of contact, eye contact, and then hand gestures. I tend to talk a lot with my hands, which can be distracting. So that's a nonverbal communication. It is important for the nurse to consider how emotions like anger, depression, and anxiety can express as an incongruency for the client experiencing a mental illness. The nurse should reassess mood and clarify if they are unsure how the client is feeling. So, looking at affect, appearance, autonomic body and eyes again for those nonverbal clues. If a patient is depressed, but they are telling you they are okay, maybe looking at those nonverbal clues on how they're really feeling. When we consider a client who's exhibiting some paranoia, maybe some poor judgment or aggressive behaviors, we may need to make some minor adjustments to our SOLAR. So the acronym surety can be used to remember the specifics of these other nonverbal cues. So remember, our patient may be displaying some nonverbal paranoia, maybe some poor judgment or aggressive behaviors, and we're just going to sit maybe at an angle, uncross our arms and legs, try to relax, make good eye contact, touch, and then just using your intuition. And you'll be able to get a lot of this from the nonverbal communication strategies. So verbal communication, before moving away from nonverbal, verbal communication consists of the words a person speaks. Words are a symbol for emotions and mental images. When we speak, we communicate beliefs and values, perceptions and meaning, which can convey interest and understanding, insults and judgment, clear or conflicting messages, and honest or distorted feelings. Some of the communication skills for nurses include therapeutic communication skills, clarifying techniques, and questions. So when we think about therapeutic communication techniques, we've now established our therapeutic relationship, and now we can begin identifying those specific needs and problems. Strong communication skills facilitate work, and these skills are called therapeutic communications techniques. Useful techniques include using silence. This can feel very awkward and uncomfortable, but silence is not the absence of communication, but a specific channel for transmitting and receiving the messages. So think about a time when someone has asked you a question, and what you really need to do is process the question. How do I want to respond? And in that moment, there is silence. We are transmitting, we are receiving that message, and we're trying to figure out how we want to respond. So silence provides a moment of reflection for that patient and that nurse. If their silence is prolonged, then it becomes it doesn't become therapeutic any longer. Frequent silence can hinder. So making sure your silence continues to stay therapeutic for reflection, but silence that goes on too long then becomes maybe a problem. The patient may start feeling uncomfortable, and maybe they're going to withhold information. Active listening is when nurses must have full concentration, understanding, responding, and remembering of what the patient is saying verbally and non-verbally. The nurse is able to hear, observe, and understand what the client communicates and provide feedback. Remember to listen with empathy. The use of clarifying techniques helps verify nurses' interpretation of the patient's messages. So what are some clarifying techniques? Paraphrasing, restating, reflecting, and exploring. So when we think about paraphrasing, this is when you restate the basic content of the patient's message. You're restating it differently and in just a few words. You're paraphrasing. If you are restating, this is different from paraphrasing in that it involves repeating some of the same keywords that the patient has just spoken. When we do reflecting, this means we're assisting a patient to better understand their own thoughts and feelings. So this may take the form of a simple question or a statement. So you could say, if you're reflecting, so this is what I hear you saying, da, 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 right? It makes the patient reflect again on their own thoughts and feelings. When we do exploring, this allows the nurse to examine important ideas, experiences, or relationships more fully. So statements may start with, tell me more about that, or describe that in further detail, or give me an example of how you were feeling. That's exploring. And the last technique is questions. So asking open-ended question encourages patients to share information about experiences, perceptions, or responses to situation. These questions don't put the patient on the defense, and they can help the nurse obtain more information. So where you're going to use a lot of open-ended questions. There might be times that you use closed-ended questions, and those really should be used sparingly, and those are just going to elicit a yes or no type answer. This type of question is usually used during the initial assessment of your patient to determine very specific results. Projective questions typically start with what if. This helps your patient articulate, explore, and identify thoughts, feelings, and behaviors they might have in certain situations. And then the last one is the miracle question. This is a goal-setting question that helps patients see what the future would look like if their problem just vanished. This can identify goals that the patient may be motivated to pursue. So, what if you didn't have anxiety at all? Right? What does that look like? What does your future look like? How would you identify goals? It gives them that motivation to pursue those goals if they can think about that miracle question of not having their problem. Some basic barriers to effective communication are excessive questioning, right? Asking irrelevant personal questions, firing questions off rapidly. This can make the client feel like they are being interrogated. You also don't want to give approval or disapproval. Praise and approval in the nurse-patient relationship can get very complex. Their patients are in a vulnerable position, and they could misinterpret the value of that comment. And as nurses, we never give advice. This interferes with the patient's ability to make their own personal decisions. And asking why questions. Why questions demand an explanation, and it usually implies that they're doing something wrong. So these why questions could imply criticism, like, why did you go to that party last night? Right? That shows criticism. It's much more useful to ask what is happening versus why it is happening. Non-therapeutic communication techniques can definitely impede or shut down that nurse-patient interaction. So what are some factors that affect communication? Personal factors can include difficulty with communication, language barriers, and cognitive factors. Depression may result in slow thinking and difficulty communication. Anxiety can cause a lack of concentration, and mania creates inability to focus. Language barriers reduce the flow of normal communication, and cognitive factors have to be considered when providing education. When we think about environmental factors, this can also definitely affect our communication. Think about all of the background noise, lack of privacy, the uncomfortable accommodations within the healthcare setting that can really reduce the flow of good communication. And then we can think about relationship factors, which can affect communication. When there's a difference in status or power, such as between a nurse and a patient, the relationship is characterized by inequality, meaning one participant has more control. This inequality decreases the patient's recovery. So we primarily think of communication in terms of what is said, but indications of nonverbal cues are a better predictor of attitude and feelings more than words are. So messages can appear to be one thing when in fact they are another, right? That conflict between verbal and nonverbal. People often are less aware of their nonverbal messages and behaviors. If you are not aware of your nonverbal messages, find a really good friend that will cue you in on those nonverbal messages. We had a student several years ago that was in simulation, and her nonverbals were absolutely predictable. The eye rolls, the heavy sighs, right? We actually had to have a conversation with her, and she was very unaware of her nonverbals. So if you don't know if you are aware of your nonverbals, find a friend. Let them tell you when your nonverbals are in high gear. Verbal messages can be called the content, while nonverbal behavior is the process. And then double bind messages are mutually contradictory messages, usually given by a person in power. So a therapeutic window is believed to be a psychological state in which therapeutic interventions are believed to be most beneficial. The nurse who is aware of cultural considerations when communicating with clients is more likely to maximize those opportunities for that therapeutic window. Individual cultures develop subtle cues in communication that can be perceived as engaging, confrontational, or signs of disinterest. A culturally competent nurse has the potential to minimize those barriers in that communication across cultures. Madeline Leininger's transcultural nursing theory really describes nursing care through social, spiritual, psychological, and physiological perspectives. Transcultural nursing is learning and understanding different cultures in order to provide better patient care. Leininger was working in a child guidance center in the 50s, where she realized that many behavioral patterns in children seem to have a cultural origin. She recognized that cultural knowledge is necessary to understand the different needs that we need to facilitate cooperativeness and healing. So let's move into a little bit of the interviewing process, right? We all kind of interview our patients as far as getting that basic health history. So how do we prepare for a clinical interview with the patient? We need to let the patient set the pace of the interview, no matter how slow or halting the progress is. Effective communication can take place anywhere. However, finding a location that makes the patient feel safe is just going to enhance that security and is important for that therapeutic relationship. The setting should be arranged so that the chairs elicit a conversation that is comfortable and non-threatening. Remember, it's that solar, right? So we're sitting in front of our patient. We do need to remember that if there's tables in between, that can maybe inhibit that conversation. So no table, maybe put the table at an angle. If you're concerned about paranoia or aggressiveness, right, then you kind of sit at that angle. Introductions are completed, and then you can just initiate that interview by asking open-ended questions. So these are some of the tactics to avoid, right? We don't want to argue or minimize or challenge our patients. We never want to give false reassurance. If we don't know, then don't say anything. Never say to somebody, it's going to be okay. We don't know that, right? That's false reassurance. Never interpret or speculate. Don't ever probe in sensitive areas. Typically, if your patient is showing a lot of nonverbal cues when we're talking about something, that's probably a sensitive area that they don't want to talk about. Trying to sell the patient on accepting a treatment is something you should avoid. joining in attacks, or participating in criticizing with other staff members. Sometimes patients don't realize they're criticizing other staff members, but the last thing you want to do is join in on that tactic. So behaviors that support counseling, we've talked a little bit about those attending behaviors. Kinesics communication is a type of nonverbal communication made by body movement. Facial expressions, body posture, and gestures are all kinesics communication. Vocal quality, called paralanguage, refers to the quality of speech that do not involve words. And proxemics, this is the personal space, usually categorized by distances, including intimate distance, right, that's 0 to 18 inches, personal distance, 18 inches to 4 feet, right, that's that friendly. Social distance, 4 to 12 feet. We should all know about social distancing with COVID. And then public distancing is 12 feet or more. So those are just different behaviors we can consider when we're counseling. And that concludes our chapter on therapeutic relationships and effective communication. If you have any questions, you can shoot me an email or we can chat about it in class. Thanks, guys.